the patient comes to me and they have severe disc disease, and we can localize the source of the patient's symptoms to the deficient disc, and everything else is ruled out, nothing else works, and they need surgery. What are the options? One of the options is artificial disc. We can actually replace a normal disc with an artificial disc. It maintains range of motion, it maintains excellent mobility. So we basically replace the patient's normal disc with a disc that's made out of composite. It has some titanium and it has a polymer that mimics the normal mobility of the disc. That normal mobility needs to be carefully assessed in the postoperative period, because if the patient's entire joint at that level is not able to support an increased range of motion from an artificial disc, the patient's symptoms may actually get worse post-op. However, if the rest of the joint is healthy, the patient gets a completely new disc, which then maintains the regular range of motion of the neck or the lumbar spine. The procedure is performed minimally invasively through maybe a 1-inch incision. It's about a 1-hour procedure. The patient goes home the same day, minimal blood loss, and usually not a very painful or dangerous procedure itself. Recovery from an artificial displacement is very rapid. Usually 2 or 3 days. I recommend to my patients not to move around a lot, not to do any heavy lifting. You can pretty much do normal activities 2 days after surgery.